Hello, everyone, and welcome. This is the Buddhist Yoga and Traditional Medicine podcast. I'm honored to have Dr. Jessica Vellela of Ayu Academy. Welcome, and very honored to have you here.
Thank you so much, Dr. James. It's a pleasure to be here.
Yes. And I want to share a little basic background information. Dr. Vellela was the first American-born physician trained in Ayurveda in India and also began clinical practice there and also graduated at the top of her class with the BAMS degree. So I want to share this perspective because I wanted to reach out to you because I've heard you've really been working to up-level Ayurvedic clinical education in the US. So why don't we begin? Can you share us a little bit about your background going to India? And it must be 5+ years training and practicing. Please share a little bit about that history.
Sure, I'd be happy to. It is a very long journey, and I tell folks that thankfully I was young enough and dumb enough to sign up for it at the time. I was in my mid-20s, and at that point, I had only known of one other American to have gone over there and graduated. So I'm technically not the first American, but the first American-born woman. And Dr. Robert Svoboda did finish the BAMS degree in 1980, and so he was technically the first Westerner across the board to complete Ayurvedic medical training. So, over the years, Ayurveda has grown slowly in the West and has been kind of as it is in India. So I think what I experienced there was very similar in some ways to what he experienced in the 80s. But it was a challenge from day one, even just from getting admission into the program. There were hurdles at every opportunity. And, the way things work in India is a little bit different. There were a lot of, at several points, bribes asked for certain things. And thankfully, I had enough support in terms of friends and mentors and guides, both between folks in the US who had, one mentor actually had his son enrolled at the same time, but his son unfortunately didn't graduate. And other friends of mine, co-workers who were Indian from Bangalore, who were able to help and communicate and navigate and kind of get me to the right place to meet the right people. So I was very fortunate in so many ways just to even get in the door. Many Westerners had tried, after Svoboda came back and in the 90s, tried to get in, and they were denied, unfortunately. So finally, I made my way in, got admission, stayed there for 5.5 years to finish this degree. And first year was like, what did I sign up for? It was a big surprise. On top of Sanskrit class being entirely in Sanskrit, and the other teachers, including the principal, just being like, hey, just sit there. It'll naturally come to you. Just keep listening like the rest of them do. You'll figure it out, was pretty much the expectation. Which, luckily I had Latin for 5 years in high school before I went over there, so I had an idea of what to do, but that's not really the way for me to learn, technically. So, going through 6 to 8 months, I got really sick. I had to do my own panchakarma within 3 months. The food was not helpful. The environment was not helpful. The pollution was not helpful. All these things kind of against me. But I managed to get stabilized in first year and pass all exams, which was a miracle unto itself. Fast forward into final year, third year, and I finished top of the class. Granted, I did switch schools in between to find a school that was more compatible and supportive in the whole learning process. And so the second school really made the difference in being able to finish. I had a whole different mindset being there and studying because I knew my time was limited. I was on a visa. I wasn't going to be able to stay there forever. So I tried to do as much as I could while I was there, including going to the hospital a year early, trying to see as many patients as possible, basically living inside that panchakarma room for 6 to 12 months. As much as I could get in there, I would, and I spent time there. And so I got to learn from many different doctors, which was different from some of my classmates in terms of the traditional educational portion. Most students finish BAMS and then they graduate, they move out, and then they train like an apprenticeship under a doctor for many years. And that's where they say they really get their training.
Give me one more. Pardon me.
Go ahead.
Hi, sorry, I'm in the middle of a meeting, and can you take a card and we'll speak another time?
Okay.
Yes.
You want me
Can you send me a message? Email? Yes, I'm sorry, I'm in a meeting. My apologies for
Fine.
listeners and to you, Dr. Vellela. Wasn't expecting any, so please continue. Yes.
Yeah. So final year came and went, final exams came and went, and thankfully passed all that, got first place in class, did my internship and decided to try to do something a little bit different and started setting up my own practice where I could actually take foreign patients in. So basically, as a communication issue, I could speak English to them and really continue learning and trying to accelerate my practical application of it.
So I want to direct readers, listeners actually to the videos on the Ayu Academy YouTube channel, because there's a lot of questions I got some insight into. One of the things I heard you speaking about was you were in the hospital, even with canonical texts. So there was a way that you experienced in your training an integration of biomedical practice as well as contemporary practice, looking at it through the eyes of classical tradition. So this is a unique education. Can you explain how that ties into the three levels you're working to promote in education: the Swasthacharya, the Paricharak, and then later the Ayurveda Charya, please?
That's right. Thank you so much for asking about that. I think one little known fact is that in BAMS, students are actually exposed to both traditional Ayurvedic medicine in the way that it has been, we think, for thousands of years, plus the current system of medicine, Western biomedical medicine and its application, minus pharmaceuticals. So we do cover everything in Western anatomy and physiology, cover pretty much everything in pathophysiology as well. And what we do is we end up weaving these two together to synchronize the understanding of both systems and application of both systems. You know, what we've lost in Ayurveda over thousands of years is phenomenal. We can't even start to think about how much has been lost. There are some estimates that say we only have 5 or 10% of the surviving texts today. Imagine, right? And so whatever we have lost, we're not going to gain back. We don't really know. But what we can do is we can use Western medicine to fill in gaps of understanding in Ayurveda. It's my personal opinion that Ayurvedic physicians trained in India today are actually the best integrative physicians in the world today. And that's a big claim, but I'm personally willing to make it. So when we look at a patient from when we have the ability to see them from both angles, now we have all doors open. We can run all Western diagnostic tests, blood labs, imaging, right? Ultrasound, CT, MRI, whatever we need. We can perform operations, which is one of the doctors that I trained under. We were in and out of the OR daily. On the other side, we also have the Ayurvedic perspective of it. So when we see the body degrade or decay into pathology, we understand the holistic picture as to why. So now say we do have what would be potentially an incurable case according to traditional Ayurveda. Someone has some type of hernia or abdominal sepsis or something that actually requires surgical intervention, right? We can now prep them with all the pre-op from Ayurveda. We can take them into the surgical room. We can do all the Western surgery. We can take them back out, do all the Ayurvedic post-op management, and have the best of both worlds. So this is even to some degree a unique experience in India today. Most Ayurvedic doctors do not practice with such synchrony. I was lucky to end up with one of the few that does. But it offers so much, as you can imagine. right? And in order to maximize that synchrony, we have to be able to pull from both systems on the spot. So that's what the training entails. And our teachers expect this of us. The good teachers do, at least. We'll go around, we'll do rounds on the floor, and we'll see patient after patient after patient, and come back to the OP, right? The outpatient room. And the teachers will ask us, okay, in this one, what is the diagnosis and why? Go get the shloka, meaning the actual Sanskrit line that shows us what the signs and symptoms of this presentation are. Now go get the other shloka that tells us what stage this patient is in. And now go get the other shloka that tells us the treatment protocol for this stage in this disease. And so just by daily repetition of this and daily practice, we're really tuned to be quick at diagnosis, assessment, right? Assessment and diagnosis, and then management. So it's a very advanced or very scientific approach that we take.
The first level of studies, there was a question you fielded, I think it was a Q&A, and it ties into this first level of training that you're offering. But you mentioned roles in healthcare, and to one degree, and I've seen this, I lived in India like 20 years ago. And that's when I got in contact with Ayurveda. And I spoke to some BAMS that had just graduated. But you had answered that sometimes the location in healthcare, both in India and I would presume also in the US, is that we might not always be primary care or the first option. So you had mentioned something to the degree of the physicians you worked with or the location. In India is that many would come with their blood work, x-rays, MRIs, but we weren't always the first line of choice. And that sets something up. People want results, and they may not be so familiar with the medicine itself. So what is the best use of this medicine, perhaps in terms of preventative care? And I think you were speaking to the Swasthacharya as a basis for situating new practitioners at that level. Is there something you could say about that?
Yeah, awesome. So, Ayurveda has so much to offer. And I think that's part of the reason why it's been difficult. We can't pinpoint it into any particular thing. Take Chinese medicine, for example. They can supposedly take acupuncture out, put it in the context of Western culture and medicine and say, see here, we have something that might work sometimes, right? Ayurveda is not really amenable to that because the whole thing either works together or it doesn't. And if we try to take bits and pieces where it is convenient for us, we lose out on the efficacy of the entire system. So looking at these roles in healthcare, the best preventative lineup for this is to first understand from Ayurveda the concept of nidana. Nidana is a Sanskrit word that means causative factors for disease. And for every disease in Ayurveda and every subtype of disease, of which there are hundreds, very specific nidana or causative factors are listed. So if one were to become an expert in only that, and they were to work with a large, broad patient population, they would probably reduce disease burden simply by removing causative factors of disease, instead of having to wait 50 years for people like researchers and whatnot to come and tell us that, oh, actually smoking is bad for you. Sorry, we told you to do it. Oh, actually processed food isn't so great for you. You shouldn't have been eating so much, right? We already know. And using that now, I think would be of great benefit to everybody. It takes a little bit of work. People have to want it. And I think that's the biggest hurdle, the biggest obstacle right now that I've seen.
And is the term, it's Nidana, Parivarjana, etiology.
Exactly. So Nidana, Parivarjana. Parivarjana means turning away from. So according to Sushruta, Nidana Parivarjana is the one and only treatment methodology required Granted, there are multiple ways in which we categorize treatment methodologies, but that is the only one that stands out as having one type. Charaka mentions two types, Nidana Parivarjana in conjunction with like calming the disease, samshamana, or palliative effects. So removing the causes may not be enough to cure the person completely, but at least they're enough to stop the inflow and the growth of the disease inside.
So you know what I thought? I thought this was so honest and realistic, because in this first level, I think, is it a year training? Year training. So there's some introduction to Sanskrit. And what were you also introducing the Charak Samhita, Shushruta, Ashtang Hridaya? But for listeners, there was another one listed, was Bhava Prakash. And I think that's amazing, because we usually don't look at that reference text, that text in US Ayurveda education. It's kind of a collation of some pharmacology information. So you're really establishing perhaps a lifelong connection to the foundations of Ayurveda, just for the first level of study. I think the realistic part about this is that I think you request students to take a year of practice. You make the title Ayurvedic Health Counselor, and you really I don't want to use that word, increase the academic study load just in this base level of health counselor. Why I find that realistic is people graduate from such programs, and I'm not saying the standards at IU Academy, but then they're left out and they feel like, should I put up my shingle and what can I do? So can you tell us about what you're looking to establish in this first credential?
Yeah, the whole field of Ayurvedic medicine is legitimately complex. From one hand, the system of medicine would not have survived as long as it did if it didn't work. So I think if we take it from that standpoint, there must be something here that can still be applicable today. Now it's a question of how do we slice and dice it? How do we turn this ocean of knowledge that's out there into something distilled that a person with perhaps no medical training, no, science, engineering, math, technology style background, right, can in 1 year expect to gain skills to be able to practice something safe for the client and efficacious. That's a huge ask right there. If you look at the classical literature, you'll see that both Charaka and Sushruta set minimum standards for students to even enroll in Ayurvedic education in the first place. Not everybody was taken. Any random person off the street couldn't just wake up one day and say, oh, hey, I want to go be an Ayurvedic practitioner. It didn't work like that. They had to come from a certain background where they were being steered in that direction. And so I think there's a huge misconception outside of India that, we can take this and make it kind of a glorified hobby in some aspects, into something that people can try to just sort of offhanded midlife, away from education for 20 years, just pick up and start learning something and then be able to advise people on matters as important as can impact their state of health, especially if they're in a chronic disease burden. That's a very risky expectation to start with. And so for me to try to overcome this in some small way was really to just put it out there and show folks this is a legitimate, full system of medicine. And if you really want somebody who can take something out of this within 1 year and be able to hit the ground running practicing, there has to be a huge depth of knowledge that needs to be acquired in that 1 year. And it has to span a broad range, because we need to make sure that people with limited training know what their boundaries are. They know what they don't know, right? They know what they can operate in, and then they know, oh, when I hit this wall and the person's not responding anymore, I better refer them to somebody else because maybe this is a little more complex than it seems. And so that's kind of where the goal came from and the way that the Swasthacharya program is designed.
I think you had advised to look at working with patients who are in a state of relative health,
That's right.
rather than, again, chronic or long-lasting, so the stage of the disease. Do you also introduce disease classification, roga nidana, and some aspects of treatment, therapy, or chikitsa in the swasthya?
Yes. Yep, very much so. And that's to create a foundation for the Swasthacharya to be able to work cohesively with an Ayurvedic doctor, mostly so that they're familiar with the terminology. And say, for example, an Ayurvedic doctor writes a prescription that says, here is the diet plan, lifestyle plan, medicine or formulation treatment plan, as well as self-care treatments or manual therapies needed. The SA should be able to read and interpret all of that and facilitate the process of that for the patient in real time.
There's a great video that you're offering, a short talk on introducing panchakarma. And what struck me was you weren't using much Sanskrit, but you really, for me, with some familiarity, you conveyed the essence of certain theories in colloquial language. So I'm actually going to use those terms to preface a specialty of yours. So you had mentioned Shodhana, Shamana, and Rasayana, and specific measures and medical theories that are appropriate. Can you talk about these three areas of medicine and what Panchakarma is?
Absolutely. So Panchakarma is kind of the gold level of treatment when we look at Ayurvedic protocols across the board. Just to put it in context, like I mentioned previously, if an Ayurvedic doctor were to write a prescription, we would expect to see a diet plan, a lifestyle plan, formulations or medicines, right? And then manual therapies. So Panchakarma actually lies in all of this. What we do is we look at that planning of those 4 columns, those 4 blocks, and say, okay, here's a patient who maybe wants to, understand how this works over the course of 6 months. They practice it at home. They experience significant improvement or any amount of improvement that they're satisfied with. And say, I want to go to the next level. What else can this do? Can it help me in any other way? And that's where Panchakarma comes in. Once a person's already familiar with what the minimum standards are, the minimum requirements of how to handle themselves day to day. So Panchakarma is meant to do a deep clean of the body, which is then going to propel the physiology of the body to behave as a solid, stable foundation for the mind. So we get a deep clean of the body plus a deep clean of the mind, meaning cognitive clarity, enhanced memory, right? Sharpened acuity, all these things across the board. And some folks will even experience spiritual benefits because of that as well, because of the across the board clarity.
Yeah.
But Panchakarma is a big, long thing. I don't know if you want me to go into like the stages or.
Well, you had introduced something, and we see it in the literature and as something helpful for family planning. So family planning, Stri Rogam, women's health. How does Panchakarma play a role in terms of family planning?
Yeah, so Panchakarma, when done properly, meaning when we use ghee as a preparatory stage to lubricate the body internally, we create a more pliable barrier, let's say, or we drop the hardness of the internal barriers so that any waste products that are hidden or latent inside the tissues can actually come out. The body is expressing stored waste in a safe way, and then we eliminate it either through upward routes or downward routes, and that's induced therapeutic purgation, or rather emesis or purgation. So that's typically the method that we're thinking of when we think about a prep to fertility or family planning. Why? Because we hit the reset button on the gastrointestinal tract. The entire digestive system is turned back a year chronologically, 5 years, 10 years. It depends on the person. And once the gastrointestinal and the digestive tract are reset, that now stages for fat metabolism reset. And what is the fat metabolism responsible for? Hormonal production. And so many of these disappointing issues that women, especially in the West, have to deal with in terms of mood fluctuations, infertility issues, variability in hormones, so much of this can get hard reset by actually doing Panchakarma properly. But we can't just, walk in one day and say, oh, I'm going to do it right now. Like we need to, right, work up to it and prepare for it. We also need to do a lot of work afterwards, because once that cleaning day happens, we then have a week of very specific diet to repopulate the gut. Then we have a gradual, diet that returns to normal over the next month, plus formulations and medicines that can dial the body into whatever we want it to do. And if it is for fertility, we can really improve that and improve outcomes for generations.
So for listeners, I'm going to jump around soon to a couple topics, some myth busting, and I would really like to hear Dr. Vellella's take on some of these ideas. But later, let's get back to this notion of delivery of healthcare, because what I heard is a model that I believe you've worked with in terms of consulting and follow-up, and also patient self-administration of therapies with oversight, and doing these at home with preparation and then oversight and follow-up. This is kind of a new model. So I want to put that there for the end as we discuss how we can connect with you, and also just think about how Ayurveda is practiced in our lives. But if we can jump around with some topics now, this I loved, and I think it's really insightful. You use the terms upashaya and anupashaya, and you translated it as testing. Now, just a quick picture. I'm an acupuncturist, acupuncture doctor, and the way that we, in a way, fit in contemporary healthcare, there are so many settings, but we do see in women's health or mental health, anything, pain, people come to us later. And I've had to work in a way, in some sense, as a problem solver, and worked with expectations and a popular understanding of, again, what Chinese medicine does. So when you mention testing and upashaya, to me it implies a relationship and a willingness to experiment and explore treatment routes, which is not usually how we approach healthcare in a consumer base. So how do you convey that this is part of treatment, is really dialing in what is the best road, and seeing not iatrogenic results, but that this is about negotiating therapeutic change and just really making sure. So can you talk about testing and upashaya?
Yeah, that's a great question and topic. And part of it is, of course, getting maybe the right factors lined up. Say you have a patient come to you and they've tried everything that they can possibly find to no avail, and sadly have been suffering with something that is, legitimately debilitating. Out of sheer desperation, many of these people are left with no other choice but to say, okay, I'll try it because I've tried everything else and it hasn't worked. So I think there is actually a large subset of the consumer, US healthcare population that knows that, hey, maybe this thing is kind of a whole big giant test anyways. I've tried all these things and they don't work, right? So if that's the case, then it's a little bit of an easier segue into saying, here's a traditional system of medicine that operates using natural products and has a framework for understanding your physical constitution type, your mental type, your emotional type, the deviation that you are currently experiencing as a presentation of pathology. And on top of that, still link it up with what is the current season's effect on you? What is the effect of your age and the chronicity of that pathology? What is the effect of all the stress and the environment around you? And put all of that together in a cohesive way. I have yet to find any other system of medicine that can do that. Now, Chinese medicine, I think, is realistically doing that as well. I'm just not aware of it. But that answer sounds very appealing to a lot of people. And so the technique I try to do is just be real with them, lay it all out, and inform them to the best of my ability via, like you noticed, communication in a language they can comprehend. That usually helps. Not talk to them in Sanskrit, right? And get it across that, there is something here that maybe makes sense. And so, okay, if we can meet at that point now, would you be willing to try a couple things and let me know how it affects you? Try being in bed at 9:30 instead of midnight, right? Try drinking freshly boiled hot water first thing in the morning and hydrating well. Try doing as many basic things, first of all, that are going to support a state of foundational health in the first place. If we can see that those things are producing positive results, then there's much better reason to believe that this person's body wants to get healthy. And that's the best sign I could ask for in the early periods of testing. Once that happens, then we start bringing in like Ayurvedic medicines or formulations, or going into more targeted, complex protocols to try to see if we can move the needle on where things are headed and bring it back towards a state of health. Most people, I think, that I've worked with, I think they appreciate it. They like thinking that, hey, here's a healthcare professional that doesn't try to pretend like they know everything, and that if they just write this prescription, this is going to produce a certain result. And the honesty that comes with that. And if it doesn't work, please tell me first, right? And let's keep trying to see if we can dial in the right thing. I tell my students all the time, I tell my folks that I work with all the time, I'm not David Copperfield. I'm not a magician. There's only so much that we can try to derive from your history, your medical history, your current presentation, the foods that you're eating, the lifestyle and the routines that you're maintaining. I calculate out of all of that, where should they be sitting right now, and then intervene on that. But I can't get the right answer all the time. I don't think anybody can. Right? So really, it is a test.
Preventative medicine, lifestyle medicine. I heard a blurb of this longevity doctor or researcher, Peter Attia, and he was talking about diabetes and how pharmaceutical regulation might be an easy option for many, and to make those kind of changes through diet, lifestyle, and exercises, it's quite a hill to walk up. Debunking some myths. I really hear how much you emphasize lifestyle and a way of health. Many are worried that they have to be vegetarian to practice Ayurveda in their life. But I heard in a diet, said steamed vegetables, maybe some chicken, right? How does Ayurveda look at vegetarianism in the contemporary context?
Yeah, that's another huge myth, actually. And we pick up any of these books. Charaka Samhita, granted, this is volume 2, not volume 1, which is sitting under it. But there is an entire chapter, one of the longest chapters in the entire text, dedicated to food substances. And it has an entire section on animal meats. What they're trying to convey, and they say this in several shlokas, is that any substance can be a medicine or it can be a poison. And it's our job and responsibility as Ayurvedic physicians to discern the correct substance for any given individual at any point in time. Now, we have a constant series of factors that are always changing as life goes on. So what's prescribed, technically speaking, as food at one point in a person's life may or may not hold true 5 years later, 10 years later, 20 years later. I don't think from a medical perspective, Ayurveda was really dead set on you have to be vegetarian, you have to be vegan, you have to eat animal products. I don't think it was like that at all. I think it was eat the food that keeps you in your best state of health at any given time. And use that as energy to fulfill your dharma. Right? One of the first shlokas that Charaka talks about, dharmarthakam mokshanam arogyam mulamuttamam. To achieve the best or each goal in life, we must be in a disease-free state. We must retain a state of health. And so they're giving us all these tools. Now, if one decides to subscribe for any other philosophical purposes to a certain type of religion, a certain type of spiritual belief system, or any such thing like that, they are welcome to follow a restricted type of diet that suits the needs of that philosophical system. There's nothing against that. But people need to keep in mind that that's a huge dial in their equation of health. And for those who do not come from generations of people who have been eating like that, for them to live in a totally foreign country or land or location, and then just decide one day up for the next, hey, I'm going to go vegan because, you know, the animals and the belts and the this and that. And that's great. That's nice. But it really does more of a disservice to their longevity and their overall health and their ability to achieve their lifetime goals.
We learn about constitution, the present state, and you talked about making the best choices with what we know. It was a talk on sattva and buddhi. If you can explain those two and what spirituality or meditation or yoga along with the lifestyle has to do. Yeah, first with that.
Yeah, that's another great topic. So Ayurveda beautifully has brought all aspects of life under one umbrella, one framework. It has a place to pretty much account for everything. And if we want to try to sum it up in a pictorial form, the easiest way to think about this is a triangle, kind of like Maslow's hierarchy of needs. And on the base of that triangle, we have all of these physical requirements. That number one, we are physical, gross, manifested beings, gross in the sense of, physical manifestation. So we exist in a physical form. And so to meet the needs of that physical form, we have to first focus on diet, lifestyle, routines, and all of that to give that physical form the best chance at synchronizing with its external environment. And that's where all this beautiful stuff from Western medicine now comes in about circadian rhythm and understanding the science behind that. We can explain that now. Once we meet the demands of that base physical layer, we can then roll up to the middle layer, and that is of mental health, psychology, and emotional health. Ayurveda doesn't talk quite as much about that, actually. That's not a focus of Ayurveda. There are only 2 chapters in the entirety of Chikitsastana which deals with treatment of disease. Only 2 chapters that look at direct psychological diseases.
Like Unmada.
Unmana and Apasmara, that's right. And so that's not the focus of Ayurveda. Not that it's to be ignored either, but how much can we expect of one practitioner to be an expert in everything, right? So that does exist there. Then on top of that sits the spiritual level, and that's really, just 5-10% of the whole picture here. There are a couple of diseases or subtypes of diseases that are noted to derive from psychological and or spiritual origin. But the way in which those were deciphered or assessed leaves a lot to be concerned with today in terms of like, well, how are we going to test that scientifically? How are we realistically going to come to believe that there is some truth behind this? We just, technologically speaking, we just haven't gotten there yet. But, you know, maybe in our lifetimes, we'll start to see inklings of it. So with the cohesion of these three, the base, gross physical form, psychological, and the spiritual, there has to be something that ties all these things together, and that's sattva. Sattva is the link between all three of these things. Sattva is the supposed, you know, according to the literature, innate sort of ability to have an open line, so to speak, to all knowledge, universal knowledge, the truth, cosmic truth, whatever we want to call it. How that sattva then gets directed in a person and applied is based on its own balancing factors, which are rajas and tamas. Rajas is like the gas pedal. Let's go, 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 go. Let's be active. And tamas is the brakes. Hold on. No, don't run that fast, right? And between these two, we're supposed to maintain some level of emotional regulation so that we can be present in any given moment and actually hear the truth. And the literature doesn't explain it maybe as directly as this, so I'm kind of, you know, summarizing, I'd say. From that sattva, we need a link. We need some way to get this information out into our physical being, right? Into our brain, our physical brain, and enact it into our physical body. And that is kind of like buddhi. Buddhi is innate intelligence or innate intuition, right? How is it that you go out to eat at a restaurant and you look at the menu and say, that's what I want? That one. And you walk out of that place feeling great. Oh man, that was so satisfying. That really hit the spot. That was exactly what I want. How do you know that? Right? Who gave you that insight? Was it because your MyFitnessPal app said you should eat this kind of food today? No. You had that feeling inside of you. Somehow, some way, that information comes through. It may be muscle memory of the digestive system in some way, or it may be something like this buddhi, tapping into this direct knowledge to know that in that moment, this is the truth. This is the thing that you want to focus in on. And so in order to improve one's connection with buddhi, to be able to even hear that, all of this work in yoga with asana practice, right? Sukham sthiram asanam, to get the body to sit still and to be stable, to be able to hear what's coming through, not just cognitively, but intuitively, to hear that and pay attention to it, respect it, and act upon it appropriately, right? All of these things like yoga, asana practice, meditation, really, I guess most of the philosophical systems, Buddhism included, are meant to allow a physical human being and that physical manifestation to remain calm enough to then tap into that and bring that full connection between the physical body, psychological and emotional, and spiritual, all into one manifestation.
For the listeners who are more into Chinese medicine or Tibetan medicine, some of these principles, they're called the Triguna or three gunas, and they're taught in Sankhya. And early Buddhist medicine draws from a lot of what we'd call in early Indian Ayurveda, but they had their own metaphysics or Abhidharma. So we don't find buddhi, ahankar, the antakarana, and some of these principles, just for listeners, it may be new, but they're really essential to Ayurveda and yoga. Mental health. So is it because it's a somatic medicine primarily? Is it, sattva vajaya? Or is this something that you had heard much about or seen contemporary reworkings of? Or an area like Bhuta Vidya in the medical classics that does not have so much extant tradition? Some people call it Ayurvedic psychotherapy.
That's right. Yep, yep. And there's a lot of crossover between this sattva avijaya, which means restraining or getting control of sattva, and psychotherapy today in many forms, and even traditional religious rites and practices in many forms. I mean, the act of charitable gift giving is considered a mode of sattva avijaya. Donations, feeding the poor, helping the poor and the homeless, right? Those are considered acts of donation and kindness that also help calm sattva and bring a person into alignment with their surroundings. So there's so many ways in which we can perform sattva avijaya. The ones that I think would probably come most front and center would be things like CBT, cognitive behavioral therapy. Understanding one's flaw that they want to try to correct and actively promoting, performing exercises, so to speak, trying to tune themselves into a different behavior. Another one, ACT, acceptance and commitment theory, right? That one also lines up very nicely in terms of just seeing things for what they are and learning to equalize one's emotional regulation, so to speak, into being able to accept and remain calm. So actually, this would be interesting, I think, for you and your listeners, is the way that emotions were seen is actually emotions were the precursors to disease and mental health issues. And some of these emotions are linked directly to the physical doshas, like Vata, Pitta, and Kapha. Some of these emotions are also linked directly to the, not Triguna, but the Rajas and Tamas of the Triguna. So Sattva cannot have any flaws, but Rajas and Tamas do. They have doshas. So really, when we look at the whole picture, we're looking at 5 doshas altogether. The 3 of the body, Sharirika doshas, Vata, Pitta, and Kapha, and the 2 Manasika doshas, Rajas and Tamas. And so these emotional states of dysregulation point to insufficiencies in a way, or dysregulation of that related dosha, be it of the mind or of the physical body. Probably very common one, I think that most people would have experienced themselves at one point or another, would be something like fear. Right? Somebody catches you by surprise and you just automatically respond. The fear response is a very primitive, innate, programmed thing. Every human will experience this at some point in their existence. That in Ayurveda is tied to Vata. It's tied to the nervous system. And so if you now sort of know what to look for, meaning in terms of signs and symptoms, you can see that in action. The fear stimulus happens, the person jumps and kind of gets excited or stimulated by that in a way. And then you see all these physical manifestations, right? Either they try to run away and hide, or they start shaking, or their temperature totally changes. They get very cold all of a sudden, right? It looks as if they've gone pale. They lose their complexion. All these physiological changes are tied to that physical dosha. And this is another way by which Ayurveda uses this connection between the physical body and the psychological space to say, hey, if a person is repeatedly exposed to these types of stimuli that produce negative responses in their physical body, that is going to have an effect on their mental state, their psychological state over time, and vice versa.
Has after the pandemic, has it shifted the way you might recognize the role of trauma or the conceptualization of trauma and its role in healthcare? Anything about Ayurveda and trauma?
It's a great question. So there are varying levels of trauma, I would want to say, first of all. It really kind of depends on the context. If we have the luxury of sitting in here in supposedly one of the greatest countries in the world, and to be able to look around and see all the supposed trauma, how much of that really is our own fabrication? And this is not to show any disrespect to anybody about what they're generally genuinely experiencing. But, you know, on the other hand, take yourself and put yourself in sub-Saharan Africa, in rural India, in Southeast Asia, in Russia, in any other place where, right, there are different degrees and different presentations of traumatic experiences happening. I think it's really important when we have a conversation about trauma to step back and to look at it from that perspective, first and foremost, and then weave the Ayurvedic part in. One thing that Ayurveda does talk about in terms of management of the doshas, there are general, beautiful prescriptions given for Kapha, Pitta, and Vata in Ashtanga Hridaya, Sutasthana, chapter 13. And these shlokas are several lines long, and they talk about a variety of physical things, panchakarma treatments, flavors that can be used, all sorts of techniques to help bring that dosha into its state of equilibrium. For Vata, which is the one that is prone to the fear response, it is very clearly mentioned in that shloka, trasana. Trasana is a Sanskrit word which means beating the person. And when this is taught to us in BAMS, the teacher literally will take a stick and say, yes, I'm going to beat you now. So, you know, if you think back to like 1950s kind of elementary school education, the boomers will understand. Yes, the teacher would walk around with a ruler and slap you on the back of the wrist if you did something out of line. And that was accepted at that time. The whole point is that discipline must be enacted in order to restrain Vata. So Vata as a thing, meaning as a dosha is made of air and space. What these two are liable to do is simply take up as much space as they have available to them. They are unbounded. They have no container. And so in order to control Vata, we must create a container for it. And this is coming back to this, you know, discussion about trauma. Why? Because I think it's really worth it for folks who are fortunate enough to live in a place like the US or any other more wealthy country where they have things available to them to really step back and say, hey, is this really something to be traumatized about, first of all? Right? And try to enact that level of self-discipline on themselves, first and foremost. That would be, I think, an amazing style of treatment. But it's, you know, I probably shouldn't even go on a recording saying these kinds of things today because it's not really taken so well. But hopefully folks who lean more towards disciplines where they do go into these long silent meditations, Vipassana style, or where they do subject themselves to regular strict kinds of, you know, activities where they have to learn something. I think those kinds of folks will appreciate and understand that discipline must be there in order to achieve some kind of goal, right? And so with COVID and trauma and everything else, hey, you know, let's go back in time 100 years and ask the folks who made it through the Spanish flu, how did they do? Let's go back and ask the folks who made it through the bubonic plague, how did they do? Right? I think this is part of being a human. And you either make it or you don't. And that's, I think, very hard for a lot of people to hear.
Absolutely. It's a very nuanced discussion, but it's a good inroads. Delivery of healthcare and data science. Our last question for today. Something I've heard a little bit about, but it's about oversight and implementation of panchakarma or self-administered therapies. Can you share a little bit about how data science, how you're working with technology and also shifting consulting?
Absolutely. I recently had the great fortune to meet a very well experienced family physician. And he said the same thing. He said, you know, I see the future of medicine and it lies in technology. It lies in the ability to be able to text your patient almost at any time of the day and give them the answer they need when they need it. right? Imagine a world where you can get healthcare on demand like that. Wouldn't it be fantastic? Well, back in the day, the stories that we have in Charaka, in Sushruta, in Ashtanga Hridaya, the physician actually would travel to the patient's home and see them in their home when they were sick and they needed care. So we had a very different model back then, but that connection was there. The expectation was there, is that when we need the expert, they will be there. And so it is with that theme that I'm trying to make Ayurveda available to people via technology. How wonderful is it that you and I can sit 1,000 miles apart and still be able to look at each other and talk to each other in real time. We are so lucky to live in this period of time with this technology. I think it's, only there to be made use of. If we can get the expertise of these Ayurvedic physicians in India or around the world to provide support needed for patients anywhere else. Imagine the benefits to society that would be available. If 100 million people could wake up tomorrow and say, I'm going to choose to be healthier, just tell me what to do. Where would that land the US economy 5 years from now, 10 years from now? Right? So we all stand to benefit from everybody being in a better state of health. And what that takes to get to that point is really a system. Western medicine has achieved amazing reach in the system that it has set up, but it still can use improvement. Anything and everything can use improvement. And so hopefully by putting this kind of model out there, where we have a team of Ayurvedic experts, Ayurvedic doctors, along with Swastacharyas, working together, along with hopefully Paricharakas one day, we'll have the backbone of expertise that's needed to then bring the instructions out to regular people who are ready to do this. We, of course, will need inpatient or in-person centers as well at some point, but the cost associated with that and the challenge in the legal landscape of the US is not to be taken lightly. So for the meantime, if people really want to be able to access Ayurveda, don't be afraid of technology. Try it out and see what a little bit of inspiration can do to spark you and bring some motivation into even some of these smallest changes. You don't know where that's going to lead and what that's going to open the door for later.
Dr. Vellela, an honor and pleasure to have you on the podcast. I hope we can meet for further discussions. How can people get in touch with your consulting and education?
Great. So for the education realm, please check out the website ayu.academy, ACADEMY. There's no .com on the end of that, so it's ayu.academy. And for the personal health development, I'm actually launching a whole new endeavor for that, and it's beautifully put together now. So come on over, take a look, please. It's called findradiance.com. And we're putting together programs for individuals to be able to discover the benefits of Ayurveda so that we can spread it much further and wider. And Dr. James, thank you so much for having me. This has been a wonderful opportunity, and I'm happy to answer any questions if anybody has any, and meet again whenever you'd like.
Thank you. So I really encourage everyone to follow up. In the show notes, we'll put those two links. And again, thank you so much, Dr. Vellela, for your time.
Thank you.